So one of the most common questions patients ask us in clinic is how long will it take us to get better? And that can be quite a complicated question because it really depends on a number of factors. Obviously, how long you've been in pain and what is the extent of the injury. If it's a bigger injury, it may take longer to heal. And if you've been in pain a longer time, then it takes longer to unlearn the habits that you will have created to protect yourself in order to avoid further injury. But in general, we can actually classify how long does it take to get out of pain in 3 ways. So the first thing is we need to control the inflammation. And inflammation is the swelling that happens in the joint to protect us. But within the inflammation, we have neurotransmitters like a text message going up to the brain, telling the brain that there's a problem. So whilst there's still inflammation, then we can continue to actually experience pain. So we need to control the inflammation, which is the first part of the question. The second part of the question is we need to try to recapture stability in the area, because when we have a problem, particularly if there's a lot of inflammation or after an injury, we lose stability in the area, which means the area becomes further irritated and further inflamed. And then the final part of the question is how long does it take for the actual structure to heal? Now, with regard to that part of the question, generally speaking, it takes around about 2 to 3 months in a worst case scenario for the injury to heal. If the injury is much more chronic, then often there'll be a lot of scar tissue in the area, perhaps in the tendon, and it'll take a little bit longer to remodel that scar tissue back into a useful functioning tendon. But in terms of how long will it take to heal, structurally around about 2 or 3 months. Once we recover the stability to the area, the inflammation should resolve relatively quickly. So in a general sense, how long would I expect patients to really notice a big difference in reduction of pain, even if they've had pain for a long time? Usually 2 or 3 months and they'll be well on the road to feeling better. It does take a little bit longer to achieve complete recovery, because by that 2 or 3 month period, when you're starting to feel a lot better and in a lot less pain, there will be a necessary strengthening program which will take 2 or 3 or perhaps even 4 or 5 months to complete. But that will then bulletproof you to ensure that the problem doesn't return.